His is a sampler of the infection control reference video authored by Dr. Pataya. The complete reference, 4.5-hour video, can be a part of your clinic's reference or library. It is the go-to reference and is in one place. You as a clinic owner should buy it. It is made up of dental practice by a licensed dentist. Infection control is to protect both employees and patients from diseases. For understanding OSHA's bloodborne pathogen standards, most states need 2 CDE per year in infection control. OSHA, which is primarily protective rules and are oriented towards the first part is inspections, the second is emergencies in building and equipment safety, the third is bloodborne pathogen standards, and fourth is hazard communications. HIPAA deals primarily with protecting the dental patient's information. The ADA followed suit in their guidelines. In 2013, the Oklahoma State Department of Health and Tulsa Department of Health published an official report on the first ever investigated and transmission of HCV in a dental clinic during implantology, which is full-strength bleach before sterilization. Oxygen, nitrous, local anesthetic, Reglan, Decadron, Propofol, Versed, Cleocin were given, but dosages were not recorded. The key factors of this investigation was: here are some cases of risks, sensitization, infections and deaths. Most are gram-negative rods. Not only do they put patients and employees at risk. Rhine-Thaler et al. In 1998 stated that a higher prevalence of children infected with non-tuberculous mycobacterium were hospitalized due to contaminated side of the Atlantic pond to the U.S. The ADA said that there are standards of care followed by the field of dentistry in the many needing surgical intervention. Here too, they needed IV antibiotics.
One does not know for sure whether smallpox was purposefully or inadvertently introduced. If it was not for smallpox, the second language in the great state of Texas today would not be Spanish, but be Nahuatl. Miasma theory stated that diseases such as plague, cholera, chlamydia, and many other diseases...
Bias and type of bias is seen by us.
Bias is seen in most aspects of life. In a study comparing the practice of infection control and safety
antimicrobial stewardship. The next few slides address use and misuse of antibiotics on tuberculous infections and did not respond to conventional treatment or antibiotics, but had to be treated with clofazimine of the disease, or there could be a residual effect of the disease, or sometimes even death.
Appropriate disinfection of high-touch ordinal categories, acceptable level of instrument, regular use of germicides, but increased wiping down common surfaces, increased frequency of housekeeping. There are 4 types of surfaces we commonly see in dentistry.
Of fever-reducing medicines such as aspirin, ibuprofen.
Vaccinated healthcare worker is exposed to a source who is HBsAg positive. The prescribed treatment is a need
in the air for long periods of time and can be breathed. Even level 1 to level 3
after school. How much can you address or learn in 3 hours? Most CDEs tout that only the meat of the program is taught. On latex
you must take
gloves
care of your
such as
hands
nitro
as it is
and
the
vinyl
breadwinner
material.
And you plan to use it in
Luckily,
dentistry for
she was
many
not
years.
allergic to one non-latex devices during use of air abrasion. Use working engineering controls. Let us address these tenets in detail. To the wavelength of the laser being used. They are available as glasses and as ease and shields. The latter is for those using loupes. Always keep 3 laser protective goggles or eyewear to be used by the patient, the assistant, and the operator. High volume evacuator up to 6 inches below the coupling. Head rest and hand rest of the dental chair.
350 TDS in municipal water and in Alvin, Texas, of greater than 1,000 TDS. Microscope. This was developed in my lab at Texas A&M College of Dentistry.
In the presence of mature biofilms, if 3 to 4 ppm bleach was used in dental treatment water, they measured in excess. Today, many clinics use Dentapure to treat the dental treatment water. Self-dissolving tablet. I tested this tablet as well. Dentapure, Mintaclean and Blue Tabs are my experience. This very advanced surgical chair had a built-in EKG system, an electrosurgery unit, a curing light, a piezo endodontic handpiece, a prophy system, a W and H implant handpiece and motor with detachable and decontaminatable suction lines that came off with.
This device was called the AutoSterile and was a part of this Castellini logo. At our school's water lines testing lab, I ran from many
active in biofilm control in our test system of our lab. On the same sample lines and possibly the same surfaces, we later studied the line surface
temperature. Blue tabs or silver dihydrogen citrate is dispensed as a self-dissolving tablets as 2-sized tablet rate than there are 2 agar. In a double-blinded study that we published looking at the effects of 7 irrigants with chemicals such as citric acid, chlorine dioxide,
instrument reprocessing and sterilization, and it involves instrument reprocessing, sterilization, monitoring with biological
tub and now placed in the ultrasonic cleaner. Instruments must be sonicated or dissecting microscope and photographed for records. The areas of the burrs examined were the shank, shaft. The ultrasonic solution in the device must be degassed. On a monthly basis, the efficacy of the ultrasonic degassation cycle will start, the given sterilization cycle time of a slow or a fast cycle. After the you may have to wait for the true or diagnostic quality of the results for up to 2 more days. Class 6 or emulators measure 3 variables and black strip from a Also, the state's boards of dental examiners blindly follow what is said in the CDC standards. This happens when the association stayed quiet due to losing funding. Indicator which entered the market only ran 150 cycles, and without a problem.